Gerard and Rhino in the studio. We are guiding you through the middle of your day with facts, fodder, and fine music. Joining us now in the studio, Dr. Jennifer Bryan, Mississippi State Medical Association Board of Trustees Chair. Good afternoon, Dr. Bryan. Thanks for coming in today.
Hey there. Thanks for having me back.
Well, we've been seeing a lot of news about the Delta variant of the coronavirus. First, explain to our audience the name Delta,
right,
and where that comes from, and how these variants get named alphabetically.
Right.
Like
so it just goes through the Greek alphabet, and it's just kind of in order. I think this is the Indian variant, but they call it the Delta variant, and it's just easier to track. Kind of, and Lambda is up next, and is the one that everybody's watching. That's kind of behind Delta. So it's just a numerical order type naming process. So
what I've been reading a little bit about Lambda, which I think is really taking its toll in South America,
right,
primarily.
Right.
So what about those letters in between there, between D and L? What happened to those?
I don't know. That's a good question. We need to ask Thomas Dobbs that. He probably knows that better than I do.
I've been reading about the Lambda, and
or maybe they aren't quite as notorious, or
maybe, yeah.
I can't. I'm speculating. Traction. Right.
Yeah, makes sense. So all right. So what do folks need to know about this particular variant, I guess, relative to the prior variants, Alpha, for example, Beta,
right.
Charlie?
So from the wild type, each one, as it's mutated, each has a different characteristic. And with Delta, it's just significantly more transmissible. There was some speculation that it might be deadlier or cause more illness, but, I have not seen any data that strongly supports that. But the transmissibility is what's key. It's just infecting people at an outrageous pace. So
when we describe it, I guess, this variant as more transmissible, what does that mean exactly? Does it mean that it's different from the other variants in how, I guess, it's carried and circulated in the, I guess, just in the atmosphere?
Yeah.
Is that what it means? Or that, even social distancing doesn't work, that masks don't work, that it's what makes it more transmissible?
You remember that Swiss cheese model of defense that everybody was circulating about a year ago? And it's really all of that, right? But it's really primarily how it locks into the receptors on the body.
Okay.
And viruses mutate. That's what they do. And as they go through the bodies of people who are not vaccinated, they have a chance to change. And this is a natural, just a genetic change that makes it more likely to bind and to infect others. So it's the natural. Yeah,
it's just the evolution
right,
of a virus.
That's what happens,
yeah.
Right.
So, but that's what I was trying to understand is I think it's been fairly well established and determined for over a year now that, for example, transmission outside is fairly rare. And I just remember seeing reports about the half-life of the virus once it is emitted, I guess, outside into the air, that it's just very short-lived, right. Much more likely to transmit and be infected when you're inside, certainly in close proximity. So is that the case with this one, though? I mean, does it still kind of have those same half-life attributes?
Certainly inside is far worse than outside, but we have heard, of cases that are, we know people are getting infected outside. I mean, we've seen those reports in the news. So outside is not a fail-safe,
okay.
But it's certainly better with air circulation. Now is not the time over the next few weeks to be indoors unmasked if you're unvaccinated, certainly. And if you're vaccinated, you may consider masking up during this time, just because there is no vaccine that's 100%. We've talked about the wonderful vaccines and how it's 94, 95% immune and nearly 100% against serious illness, hospitalization, and death, but still you can fall ill and have some problems. So our elderly, our immunocompromised, those who are vaccinated may consider at this time taking those precautions over the next few weeks.
Yeah. So that was one of the questions on the text line here. Are people getting the Delta variant that have been vaccinated already? It's my understanding that the vast majority of those that certainly are testing, or certainly those that are being hospitalized, are unvaccinated.
Right. So by and large, people that are being hospitalized and those who are dying are the unvaccinated. Those who are vaccinated, yes, we are seeing some sporadic cases of that happening with reinfection, but generally they are mild or even asymptomatic. People may not even know because that's what the vaccine does.
So there's the question, does vaccination prevent mutation?
Does vaccination prevent mutation? So vaccination decreases your rate of infection, but viruses, once you are infected, can mutate. Yeah. The way to get rid of mutations is for the immunity to develop, right, and for us to have less prevalence of disease. Thankfully, coronavirus family is a slower mutating virus, like compared to HIV, who just rapidly mutates. It's crazy how fast HIV mutates. So we did have that going for us with coronavirus, but still, if you infect the entire world with a virus and it replicates enough in enough people, you're going to see the mutants developing.
Yeah. Well, I think the main thing, though, is even if it mutates and it spreads, if other folks are vaccinated, well, then the spread, it just doesn't make them as sick.
Exactly.
That's the idea.
But, I mean, and the key point here is the way to get through this, and we can focus on all the academic stuff, but it really is just to decrease the prevalence. If we can get our vaccination rate up off the bottom, if we can vaccinate more people and stop this in its tracks, we're all going to be so much better off.
Yeah. Yeah, so Anthony in Louisville says in the Greek alphabet, Lambda actually does come after Delta. So I wasn't aware of that.
Sounds
Appreciate
great.
that. I should know that for being in a fraternity back in those days when I used to have to recite the Greek alphabet, but 40 years ago, so I don't remember it. Yeah, appreciate that. How about those with antibodies? Will they get the Delta virus? So if I've been infected already, let's say, with the alpha version of coronavirus.
Yeah, the wild type certainly can. We do know that we see cases of people getting infected and repeat infections. The Delta virus is still coronavirus, and you can still catch it. There's a report of a lady overseas that just died, and she had 2 variants at the same time. So it doesn't... If you have antibodies from a previous infection, you're certainly, you need to vaccinate. You need to vaccinate to get that robust immunity from the vaccine that gives you the best protection.
Yeah. So even if you, like in my case, I had a mild case of coronavirus back in November. I was vaccinated in March. I waited my turn, and that's back when there was kind of a rush and wanted to stay in the back of the line, if you will, because I knew I had it already and felt more protected than those that didn't have it. And based on my age and other health issues, I just waited. So, but still a good idea.
Absolutely.
Yeah.
It's a wonderful idea. It's crazy the times that we're living in. I mean, we're living history. We are living in a global pandemic, and people are dying needlessly. And just this morning, we saw the update. I think I was telling you before we went on air that there are 12 kids in the ICU in Mississippi, and 10 are on ventilators. And that's simply because Delta variant is so transmissible. If you infect, yes, kids do better, but if you infect enough kids, you're going to see the bad outcomes. If you infect enough adults, you're going to see more bad outcomes.
Yeah.
Hoping that this is nothing like January, but we're definitely seeing some problems.
You've certainly, as a physician, you're hearing the objections from people. What are they saying? What is their hesitancy?
In my real job, I'm a family doctor,
yeah.
and so we have this conversation every day. And what we know is that people rightfully fear. That's a normal instinct that keeps us alive, right? To be concerned and to pay attention to things. And they don't understand what they might not know, and they've heard things. And I hear a lot of times about, I just don't know what to believe or who to listen to. And I would just remind them, that's still your doctor. That's still your physician that can sit down, that you trust, that you've trusted to advise you on your heart disease or your cancer or whatever else. This is the same thing. An infectious disease, they're going to lead you through it. Vaccines are safe, effective, free, and widely available and are the way off the hamster wheel.
I guess the question that has always kind of perplexed me, Doctor, is a lot of people that are not taking the vaccine probably take other medicine.
Absolutely.
Why are they willing to do that, but not the vaccine? It's medicine. What am I missing there?
Pandemics cause a lot of unrest, a lot of stress on people, and it's the unknown. It's what is this? I need to take a shot. We are seeing more and more people understand and that are talking to their doctors, and just want to encourage those conversations, because at the bedside you can really take that time to get those questions answered.
We got a break. Can you hang around? A couple
Sure.
more questions.
Yeah, glad
We got
to.
Dr. Jennifer Bryan from the Mississippi State Medical Association as our guest in the studio. The JT Show with Dr. Jennifer Bryan with the Mississippi State Medical Association is our guest. We're talking the Delta variant, vaccines, and the like. And let's see here. This is Dr. Jennifer Bryan had an interesting testimony at the Senate Health Welfare Committee regarding medical marijuana 3 or so weeks ago, Ben from Madison. Yeah, we're not talking about that today, but I do recall that.
Yeah.
So appreciate you pointing that out there, Ben. So Thomas says, well, most of the folks that are in the hospital in Greenwood, it is his understanding, have not been vaccinated. So does that suggest then, Thomas, that you think the vaccines have like zero effectiveness? Because I think if that were the case, we'd be seeing way more cases, way more hospitalizations, and way more deaths. So I'm not sure what the point of that is, but as Dr. Bryan has suggested, which has been the case since the vaccines were introduced by the vaccine makers, it ain't 100%. Mm-mm. And you were explaining to me something off the air, Dr. Bryan, about if you have certain medical conditions already before you take the vaccine, well, the vaccine may not be as effective.
And we know that, right? I mean, like cancer patients, COPD, heart disease, elderly. If you get an elderly person with several underlying serious illnesses, we know that the vaccine is not as effective in some of those people.
Yeah.
So, there are nuances to all of this, but when you look back at aggregate statewide data, it is clear that those being hospitalized and those who are dying are largely the unvaccinated.
Yeah. I mean, I've got several physician friends, as you know, and as our listeners know, and I talk to them about this. And these are high-ranking people in the medical community, in the hospital environment, certainly here locally, and that's exactly what they have said, and I believe them. I have no reason not to.
96% of United States physicians they're fully vaccinated.
Huh. Interesting.
It's almost like the doctors know something about these vaccines, right? It's phenomenal. 96%, and we took ours here in Mississippi in December because that was when we were surging. We had the health care on the front lines and so on, and it was just a no-brainer from looking at the science back then of we're going to do this, right? It's the right thing to do.
So that's an interesting point. So one of the questions on the C Spire text line is to ask you about concerns about future complications, problems, et cetera, which I think is a valid question.
Absolutely.
And concern for anybody that has that. But gosh, if 96% of physicians are fully vaccinated, if there are future problems, we ain't going to have no doctors in the United States.
Well, let me just say, first of all, there's no shaming here. Like, I understand it. People have concerns, and we want to meet them where they are. That's why we say have these conversations with your doctor. But, 96% of physicians are vaccinated for a reason. These vaccines or this type platform had been studied for a decade prior to this in searching for an HIV cure. So this had been looked at and studied. And when you look at it just on the simplistic basis, it's a very elegant vaccine design that is in and out of your system very quickly. And we've not seen really any bad effects across the population from the vaccine. Long term, we expect that to be negligible. But I can tell you about COVID, and it's killing people. Yeah. And we're seeing them back in clinic. And I diagnose long COVID up and down the hall of my family practice every single day. These people can't breathe. They can't remember. They're having blood clots, heart attacks, strokes. When I tell you that it does not end when they leave the hospital. Dying is not the only endpoint here.
Yeah. And you're so right about that. That's always seems to be the talking point, the retort from folks that are hesitant. They say, well, I'm just not going to take a vaccine that I view as risky when the chances of dying are, some minuscule percent. But what I guess doesn't enter into that conversation are the other potential long-term effects that some people have that endure.
The virus is at least 1,000-fold riskier than anything that you're going to read about from the vaccines.
Makes total sense. So do you have any data? This is on the C Spire text line from Bryan. Can you share any data about how many have had complications from receiving the vaccine? I know there's some collection of that's stored? I'm not sure if it's at the state level or the federal level, or maybe both.
Probably both, but definitely at the federal level. There's some. Nobody's going to ever tell you that there is not something somewhere that can happen. If you want to really freak yourself out, read about the side effects from aspirin.
I'm one. I'm allergic to it.
Right.
I had it as a child.
It's everything. There's some minuscule possibility. And when you go to the pharmacy and you pick up your blood pressure medicine, you get a sheet this long that's got typed every possible reaction that you can have. So somebody somewhere is going to have a problem. But we are not seeing that on a large-scale population basis. What we are seeing is lives saved.
Yeah. So, of course, with any medical treatment, anytime somebody's doing something to your body, there's always a risk. That's absolutely the case. But you got to kind of weigh that out and calculate it. In this case, the vaccine versus contracting the disease.
Right. But, all of this is kind of processing. This has been a trauma that has happened around the world to everybody all at once. And in times of trauma, you just kind of think, go back and talk to the physician you have always trusted to give you the straightforward answers on what to expect. Vaccine is the way to go.
Can you explain when it will be approved? Do you have any idea when the FDA will approve it? And is that a concern that it's currently being administered, I guess, with an emergency approval from the FDA?
No. I mean, I don't. I would hope this year, but I don't know. I haven't paid attention to that as much. But no, I'm not concerned. If we hadn't had the EUA, we would still be sitting around watching people die. I don't think our healthcare system could have stood it. I know it couldn't have after what we went through in December. That was not a possibility to sit around and wait for perfection. This was a wartime effort in most doctors' minds, and we've got a safe and effective vaccine.
A lot of people point to, the number of regular flu cases is down, and they try to make some connection there. What do you think about that?
Well, certainly we know that masks and sitting at home away from other people kept the flu down. We tested for it like crazy in my own practice. It was not out there. We are, seeing a lot more respiratory illnesses this summer, but we also are going around each other. And so I think you were asking me earlier about where to get vaccines.
Yeah, I'm sorry. Yes, please.
So the easiest way to do this is just to go to vaccines.gov. G-O-V, and there you can literally put in which vaccine you want and where you are, and it's going to give you a list of all the pharmacies right around you that have exactly what you want.
I'm seeing signs outside of all the pharmacies, like
it's
little
everywhere.
tent signs everywhere. So
and it's free. It's free.
Yeah.
That's a big message. Some people worry about the cost, right?
It's
free.
No
it's
cost.
Free.
Yeah. So, and let's be clear, we're not scolding people.
No.
We're not shaming them. And I honestly think that we would have much greater penetration and acceptance of the vaccine if some of the political leaders and their surrogates would just stop with all the ridicule and the shaming and the admonition. That just doesn't work, in my view. I think it makes people more dug in. This is really more a matter of let's get the facts out there and let's just encourage people. But we freely acknowledge it's your choice.
It is. It is everyone's choice. I can remember a time when I was a patient and went to the doctor, and what political party they were affiliated with never entered my mind. And I went to who I knew was going to give me the best advice. So physicians are unified on this with 96% vaccination rate across the country. And my message is strong and clear to protect yourself and protect your family by vaccinating.
Here's a C-Spire message on the C-Spire text line. Y'all listen to Dr. Bryan. She is super smart. That's why she's my doctor. How about that?
Thank you.
She's telling us we need to take the vaccine. If something happens to me after I take the vaccine, can I sue her or can I sue the state or the federal government?
Yeah, somebody said that on Twitter to me today as well.
That's crazy.
Yeah, no, I mean, I was raised by a lawyer, and my brother's a lawyer, and I think even they would say that this, again, wartime effort, trying to save as many lives as possible in a global pandemic. I have not really thought much about who I would sue.
I mean, look, the reality is in this country, you can, for $35, I think, go file a lawsuit, sue anybody you want for anything, and some lawyer will write it up for you. Now, how far that gets.
But, times are not normal. I mean, we're in a healthcare staffing crisis, which is a whole other conversation. Folks need to understand the stress that healthcare workers are under.
Yeah,
it's phenomenal.
Much respect for Dr. Bryan. She sounds very smart and reasonable. Ben from Madison. Appreciate that, Ben. Doctors had to take the vaccine so they could get back to work. You guys weren't forced, were you? Or
No, absolutely not. No. We lined up voluntarily to show that we believed in it and that we were not afraid and that we practiced what we preached.
Does she support mandatory vaccination? Thomas, we already established that. She and I both agreed. You've heard me say it 100 times, and Rhino at least. Have we not, Rhino, on this program? No, we don't. We don't support mandated vaccines. But we do encourage. We
strong recommendation, right? Strong recommendation to protect yourself, right?
Dr. Bryan, thanks so much for coming in. Really appreciate it. I think that was very informative, and I think our listeners enjoyed it.
Well, I appreciate you and the listeners. Thank you.
You got it. Dr. Jennifer Bryan with the Mississippi State Medical Association. We'll be right back with the JT.